Welcome to VR Nursing Academy, produced by Rajendra Singh. आज का अपना टॉपिक है मेडिकेशन, पार्ट 1. First question is, the nurse is caring for a 55-year-old patient in the medical surgical unit. On entering the room, the nurse finds the patient alert, oriented and the skin color appears healthy and pink. The nurse observes an electrocardiogram and notices absent P waves. Which initial action is the most important? Option A. Defibrillator. B. Cardioversion. C. Pacemaker preparation. D. Intravenous amiodarone. In which correct answer is? Option D. Intravenous amiodarone. Next question is, a 27-year-old woman present to the emergency room with decreased reflexes, hypoventilation, hypotension, and fused pupils. A family member who is accompanying the patient has bottle of diazepam which the label states was recently. The family member also indicates that the patient has a depression. What intervention should the nurse expect to administer? Option A. Naloxone. B. Active charcoal. C. Tap water enema. D. Magnesium sulfate to reduce the risk seizure. In which correct answer is? Option B. Active charcoal. Next question is, a 55-year-old man was admitted with complaint working for 3 days. The nurse is preparing to administer infusion of saline 1000 ml over 6 hours. What is the hourly infusion rate that the nurse needs to infusion therapy in milliliters per hour? Option A. 155. B. 167. C. 190. D. 217. In which correct answer is? Option B. 167. Next question. A nurse received the serum digoxin level result for the patient that day and notes that the result is 2.6 nanograms per milliliter. Normal level is 0.8 to 2 nanograms per milliliter. Which of the following nursing actions is the most important? Option A. Notify the physician. B. Check previous vital signs of patient. C. Record normal value on nursing notes. D. Administer scheduled dose of medication. In which correct answer is? Option A. Notify the physician. Next question. A nurse is caring for a client with bipolar disorder who is receiving lithium carbonate. Before administration of the next dose, the client complains of nausea and vomiting and the nurse finds that the client's lithium blood level 1.5 milliequivalents per liter. Which of the following actions is considered a priority? Option A. Administer if fluid. B. Withhold the next dose. C. Call the client's physician immediately. D. Repeat the blood lithium level testing. In which correct answer is? Option B. Withhold the next dose. Next question. Soldier was brought to triage area after being exposed to chemical weapons. Signs and symptoms of nerve gas exposure were noticed. A nurse prepares for medical management. Which medication should the nurse prepare for the patient? Option A. Atropine. B. Adrenaline. C. Sodium nitrate. D. Sodium thiosulfate. In which correct answer is? Option A. Atropine. Next question. A 60-year-old woman presents to the clinic with a primary complaint of fatigue. Analysis shows a smooth and reddened tongue with a loss of papillae and palate mucous membranes. She complains of a sense of constant fullness of the stomach, with a decreased appetite and 2-3 loose bowel movement per day. A neurological assessment shows numbness in the feet and lower legs. The patient type of test would the most likely? Option A. Vitamin B12 level. B. Schilling. C. Folic acid level. D. Erythropoietin. In which correct answer is? Option A. Vitamin B12 level. Next question. A 30-year-old man admitted to orthopedic ward complaining of throbbing pain in casted leg. Which of the following nursing intervention should be taken first? Option A. Administer PRN medication. B. Assess pedal pulse. C. Remove the cast. D. Notify a doctor. In which correct answer is? Option B. Assess pedal pulse. Next question. A patient with a history of arterial fibrillation has an order for 0.25 mg of drug X. The available supply per dose is 0.125 mg. Which of the following dose is correct? Option A. Return tablets to the pharmacy and reorder. B. Dispense 1/2 tablet to the patient. C. Dispense 2 tablets to the patient. D. Administer 1 tablet twice daily. In which correct answer is? Option C. Dispense 2 tablets to the patient. Next question. Patient with ongoing magnesium sulfate, the nurse should be alert to? Option A. Respiratory rate. B. Temperate. C. Heart rate. In which correct answer is? Option A. Respiratory rate. Next question. Clomiphene citrate, Clomid, is prescribed for a 30-year-old infertility treatment. The nurse should understand that this medication is used for following actions. Option A. Stimulate the release of follicle-stimulating hormone. B. Decrease prolactin level. C. Reduce endometriosis. D. Induce ovulation. In which correct answer is? Option D. Induce ovulation. Next question. A 50-year-old distressed and restless patient in the psychiatric ward was unable to sleep during the nights for the last 2 days. He was ordered sleep medication which was to be administered at 10 p.m. At the time medicine administration, the patient was found asleep in bed. Which of the following actions should the nurse take regarding the dictation? Option A. Leave it at the bedside for the patient. B. Discard medicine and cancel the order. C. Wake him up and administer. D. Hold, record and report. In which correct answer is? Option D. Hold, record and report. Next question. A 75-year-old woman who lives in a long-term care facility has been having repeated episodes of urinary tract infections. She is prescribed denamine mandolate 1 gram to be taken by mouth 4 times per before meals and at bedtime. The nurse advises the patient that she need to remove milk from the diet while taking the medication. What is the primary purpose for this dietary advice? Option A. To prevent malabsorption of medication. B. Decrease risk of gastrointestinal upset. C. Reduce effectiveness of medication. D. To make the urine acidic. In which correct answer is D. To make the urine acidic. Next question. Doctor ordered to give medication X 300 milligrams and available is 900 milligrams per 6 milliliters. How many milliliters the nurse will give? Option A. 1.2 milliliters. B. 2 milliliters. C. 4 milliliters. D. 6 milliliters. In which correct answer is? Option B. 2 milliliters. Next question. A 35-year-old female presented to the emergency room with complaint of symptomatic bradycardia. Appropriate nursing intervention include establish intervention access. What is the possible drug to be given in the IV solution? Option A. Calcium channel blocker. B. Anticoagulant. C. Atropine. D. Digoxin. In which correct answer is option C. Atropine. Next question. An older adult client with renal failure comes to the emergency department with a report of nausea and vomiting. The client's heart rate is 45 beats per minute. The nurse is most concerned about which medication that the client takes. Option A. Nitroglycerine. B. Doxorubicin. C. Furosemide. D. Digoxin. In which correct answer is option D. Digoxin. Next question is, ECG showed ST elevation to confirm diagnosis of MI. The nurse expect to do? Option A. Cardiac catheterization. B. Troponin level. C. Echo. In which correct answer is option B. Troponin level. Next question. A 5-year girl was playing outside. She came to her mom crying and holding her right upper arm. She went to the hospital with swelling over the upper arm and itching. The appropriate management is option A. Administer subcutaneous epinephrine. B. Maintain patient airway. C. Prepare for intubation. In which correct answer is option A. Administer subcutaneous epinephrine. Next question. Doctor ordered to give 75 milliliters over 12 hours of normal saline. How many milliliters total should be given? Option A. 1000 milliliters. B. 900 milliliters. C. 600 milliliters. D. 450 milliliters. In which correct answer is option B. 900 milliliters. Next question. A nurse is preparing to administer an intravenous infusion of 2000 milliliters of Ringer's lactate over 12 hours. The administration set has a chamber that delivers 15 drops per milliliters. How many drops per minute should be administered? Option A. 56 drops per minute. B. 42 drops per minute. C. 24 drops per minute. D. 14 drops per minute. In which correct answer is option B. 42 drops per minute. Thanks for watching. Please like, share and subscribe the channel and press bell icon.